What I want to talk about in this video is my lip reduction technique, and I use something called a bikini reduction, which I'm going to show you. This is sort of a typical patient that comes in and she was complaining that her upper lip and her lower lip were both too full and that they sort of protruded too much. And this is her from the front view, and I also have a view from the side. And here you can see that her lower lip does sort of protrude beyond the upper lip, and she's just unhappy with this, and she wanted her lips reduced in size. So what we do for this procedure, for the markings, are again what's called a bikini pattern reduction. And the reason for this is that when lips are reduced, if just a uniform wedge is taken from the lips, then when the lips are closed, what you'll have is sort of a uniform looking lip. And what we really want to do to make the lip reduction look natural is to preserve the natural aesthetics of the lips. So sort of an ideal looking lip has a nice tubercle here in the front and the top. And you can see there's sort of a little depression that goes back, and that corresponds with the height of Cupid's bow in the philtral columns, as opposed to just sort of a uniform sausage that goes all the way across. And the same thing with the bottom lip, is there are two sort of pouty fullnesses on the side, and then a central sort of depression, and the lips taper out laterally. And again, if we just excise a uniform wedge, we can't preserve those aesthetics. So what we do here with the bikini markings are basically, when the patient comes in, I ask them to close their lips as you saw in that first picture, and I mark the border between the dry vermilion, which is the part that is outside of the mouth, the pink part of the lip outside the mouth, and I mark the junction between the dry and the wet vermilion. The wet is the part that's inside the mouth. So when the lips are closed, we put a mark at that juncture, and that would correspond to here and here. Okay, and then what we do is we roll the lips in a little bit to see how much we will take, and then we put a mark on the outside like that. And the idea here is, as you can see in this bikini, is we take less skin here in the center because we want that tubercle to have more left behind in the end, and we actually take a little bit more here corresponding to the height of the Cupid's bow in the philtral columns, so that we get a little bit of a depression, and then we taper it out, and that looks like sort of a bikini top on the upper lip. In the bottom lip, since we want sort of a depression between the two lower pillows, we take more centrally, and so that's why this distance is farther apart than any of this distance here. So we take more, we gather more, and we get a little depression in the central lip, and then we get these nice little out pouchings here, or pillows here, and we taper, and this sort of looks like a bikini bottom. When we're done with the procedure, the patient looks like this. So this is the before. She had very tall lips and very full, and afterwards, as you can see, the shape of the lips is excellent. She has a nice little tubercle right here, and the little indentations here which correspond with the Cupid's bow. She has a little depression in the central lip and two very nice pillows laterally. And this is her profile. You can see that the lower lip doesn't hang out quite so much, and the height of the lips also has been reduced.